Hello, I am Dr. Mirela Cerneianu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Hello, listener, and thank you for joining me again on another podcast episode where the topic it's about hysterectomy, which is removing the uterus in a woman. And I entitled this Hysterectomy to Do or Not to Do, and it's part 1 and part 2. The part 1, today's episode, is mainly about why would your doctor recommend removing your uterus and why this procedure might give you freedom from pain and bleeding. The second episode, which is next week, will focus on what are the negative aspects of removing your uterus, what are the risks and the alternative solutions to avoid removing your uterus. So without further ado, I'm going to dive right in. First of all, as an OBGYN specialist, I performed and I helped perform as a co-surgeon many hysterectomies. There are a lot of misconceptions and a lot of myths surrounding this organ. Even the name that we still use, hysterectomy, has a slight anti-feminine meaning. And the reason is because the uterus was considered to be the source of hysteria in women back in the day, way back, hence the word hysterectomy. I'm not going to dig into history and why hysterectomy, the name, but basically hysterectomy equals taking your uterus out. So first of all, let's talk about what a hysterectomy is. Then I will discuss why it might be needed or recommended. And then I'll discuss some hysterectomy pros, followed by the next episode next week about the negatives, the cons, followed by a discussion on alternatives to having a hysterectomy. So first of all, I will start the episode right now by literally advising every person who listens to this podcast, especially women, that this is not meant to be medical advice. This is an educational, informational podcast that is meant to spread and disseminate facts, discuss science and data that is well known. And when I will share my opinion with you, I will let you know it's my opinion. It will be very clear. So having a hysterectomy means removing your uterus. The uterus can be removed and the cervix, which is the entrance organ to the uterus, can be conserved. The medical term for this type of hysterectomy is supracervical, maybe partial hysterectomy, depending on who you ask and how old that person is. Removing your uterus does not mean removing your ovaries. A removal of the uterus and ovaries together at the same time used to be known as total hysterectomy. Some of the most conventional OBGYNs that have been around for a while might even use the term total or partial to indicate removal of the ovaries or not. Now, up until 20 years ago or so, many gynecologists were men, and they were trained that leaving the ovaries behind after the age of 40 or 45 would invite pathology. So if a woman has a hysterectomy after the age of 40, 45, she, in the past, might have also been offered to remove her ovaries, which is the equivalent of a male castration. Now, the good news is we don't do that anymore. The GYN doctors stopped removing ovaries as more studies and data published suggested that removing ovaries early and pushing a woman into premature menopause, unless indicated, could be very, very detrimental to her health. Thank God for those studies. And of course, that has a totally opposite extreme to it in the sense that, well, if all is well and my uterus is sick and needs to be removed, so be it. But as a woman, if I am postmenopausal and I need a hysterectomy, maybe I should keep my ovaries. And I get this question a lot. And you should know that keeping your ovaries after menopause, if you are using hormone replacement therapy, is not recommended because they clearly are no longer making any hormones, obviously, because you need hormone replacement therapy. So you are making a decision to keep an organ that is no longer serving you and has a chance of cancer. So you should remove it if you have surgery to remove the uterus. Now, I will discuss this more in my future episode about ovarian cancer, but you should know that 50 to 60% of ovarian cancers that happen are in women over the age of 65. And yes, the chance of ovarian cancer, it's about 2% or under. And very few women, 1 in 87, are expected to develop ovarian cancer in their lifetime. It is a rare cancer, but it is one of the deadliest gynecological cancers because it is always late and advanced when diagnosed. So remember, 1 ounce of prevention is worth a pound of cure. It's my favorite saying. So when confronted with the surgical option of uterus removal, the hysterectomy that we're talking about today, after the age of 50, especially if your ovaries are no longer working to make hormones, and again, that's very easy to document with blood testing, please consider removal of your ovaries to avoid ovarian cancer later. So now I'm going to close this parenthesis here. I will come back to the ovarian cancer subject in the future. Let me get back to the subject at hand, which is the hysterectomy, removing the uterus, to do or not to do, to have or not to have, to remove or not to remove. So a total hysterectomy means total removal of the uterus, as well as both ovaries and tubes. And a partial hysterectomy might mean your ovaries are left intact and possibly your cervix as well. So after clarifying these terms, let's discuss why have a hysterectomy. Why do we need to sometimes remove the uterus? Well, usually the answer is very simple and very clear. We want to remove the uterus as doctors because the uterus has developed a pathology that makes it very problematic and symptomatic, meaning your uterus is causing a lot of problems. Pain, bleeding, pressure on neighboring organs like the bladder and the rectum, or the nerves of your lower back. And obviously, you might be getting to the point where these symptoms cannot be controlled with medication, with hormonal manipulation, or when you have an endometrial ablation, which is a non-surgical treatment, and the relief is only temporary. The symptoms come right back. So what type of uterine pathology or disease justifies a hysterectomy? Well, the most important reason for the uterus to be removed, and there's no ifs and buts about it, would be any type of genital cancer. Uterine cancer, cervical cancer, ovarian cancer. But surprisingly enough, that is not the most common cause the uterus is removed for. The number 1 cause for hysterectomy in the United States is actually fibroids and heavy excessive bleeding likely caused by adenomyosis or uncontrolled estrogen dominance. Now, I have already discussed these pathologies in a previous podcast episode, so for details, please go back and listen, but I am going to mention a few things here and summarize what I talked about previously. First of all, fibroids are a smooth muscle tumor, always benign, 99.9% of the times, that develops either inside or outside the uterine wall, sometimes inside the uterus, and in about 99.9% of the cases, it's always benign. The risk of malignancy with a fibroid development is very rare, and it's called a sarcoma. That's 1 in 1,000 or less. So why not treat these fibroids with medication? Well, and I used this analogy before, but if you're driving, don't do this. If you're not driving, please try to reach behind your ankle and touch your Achilles tendon. You can feel it's very hard, and that's usually the consistency of most of these fibroid tumors. Once they develop, we can't cure them with medication. We don't have any medication that would regress or melt down this type of tissue that is as hard as your Achilles tendon. So we're kind of stuck with them on the uterus. Now, we have new technologies which are addressing fibroids, but they're meant to shrink them. The only cure for fibroids is removing them surgically. Removing a fibroid surgically without taking the uterus out, it's called performing a myomectomy. Again, and this is an alternative to a hysterectomy. That's why I'm mentioning it. So again, cutting out the fibroid and repairing the uterus back together with sutures is called a myomectomy. This is a procedure that spares your uterus, but is not necessarily recommended in women who have finished childbearing, they're done with having kids, and are over the age of 45. Removing the fibroids only and leaving the uterus behind will create many possible problems later in life when the woman enters menopause. And guess what? Now she requires hormone replacement therapy because the uterus can develop new fibroids and can have symptoms again, requiring another possible surgical intervention, maybe an ablation, maybe a Mirena device with its side effects. Or, worst case scenario, you decide, well, I can't tolerate it. My uterus can't take it. So now I have to receive a significantly lower dose of estrogen. And that is your main sex hormone, the one that makes you tick as a woman, the one hormone that rejuvenates you head to toe, inside and out. But unfortunately, estrogen is also the hormone that can rejuvenate any existing uterine pathology. So estrogen after menopause will definitely rejuvenate your fibroids. So food for thought on this. I will stop here with musings on fibroids. I have dedicated an entire podcast to fibroids. So more on this topic, please listen to the podcast that I entitled, How Do You Know You Have Fibroids and What Are the Modern Treatment Options for Fibroids? After fibroids, the second most common cause for hysterectomy in the United States is abnormal uterine bleeding. In a great majority of cases, this is due to the uterine pathology condition known as adenomyosis, also known as endometriosis of the uterus. Now, I like to use visual aids, and I think images can speak louder and clearer than any words in many circumstances. If you're not driving and you're listening to this, please Google the word adenomyosis. It is spelled ADENOMYOSIS. And then click on images. You will see easily side by side a normal uterus as opposed to a uterus with this type of pathology. Clearly, the uterus is normally composed of muscular fibers that stretch during pregnancy and contract during labor, during pregnancy, or during a period. When intermixed and grown between those muscular fibers, we now have tissue that normally only grows inside the uterus, and that's called endometrium. Let me explain some more. Imagine the lining of the uterus, called endometrium, starts insinuating and infiltrating throughout the muscle fibers. This process will cause your uterus to swell up with blood, not inside the cavity, which is the part where you menstruate, but inside the actual uterine walls. This will cause pain, bloating, heavy periods, crampy periods, lots of clots. And this type of tissue, endometrium, that only exists in the uterine cavity as a lining of the uterine cavity, will suffer specific changes throughout the cycle, the menstrual cycle. It will grow, it will shed, it will bleed with each period. So the uterus of a woman who has this condition, who has adenomyosis, will literally swell up and fill up with blood before and during her menses, and especially during the second part of the cycle, which can cause heavy, painful, very long, clotty periods. I talked more about this in my episode about adenomyosis, so please go back and listen if you want to know more information. Now, the loss of estrogen at menopause and after menopause will be very helpful, as these changes will no longer suffer the proliferative effect of estrogen, and the symptoms of adenomyosis will disappear. No more estrogen, no more periods, no more problem. But the problem is that these changes can resurface again once hormone replacement therapy started. Remember, any estrogen after menopause will definitely rejuvenate you, but will also rejuvenate your uterine disease, whatever that might be. That's why I always like to do a pelvic ultrasound as a baseline to evaluate for possible pre-existent uterine pathology. And I honestly believe it should be standard of care to check your uterine lining every year at the time of your womanly checkup exam to evaluate it for possible changes under the influence of estrogen and progesterone therapy if you use hormone replacement. Even if you don't use hormone replacement, things can happen after menopause in the absence of hormones. So please have an ultrasound annually. I talked more about this in a previous episode. So again, let me stay on topic and let's talk about what are other possible causes for which hysterectomy might be indicated. Well, a large uterus that is tilted backwards can cause severe back pain. Women that have a tilted uterus, also known as retroverted uterus in medical world, can and might experience significant back pain before or during the period. These women can experience enormous relief of their back pain once the uterus is removed. The uterus enlarges and swells up with blood during every period, and it can cause pressure on the muscles and the nerves in the sacrum and the lower back area, which will cause back pain and all sorts of other odd symptoms during a period. Now, also women who experience painful sex, especially with deep vaginal penetration, are most likely suffering from endometriosis around the cervix. So every time they have sex and the penis touches the cervix at the end of the vagina, it can cause pain. Remember, the cervix is this barrel-shaped structure at the end of the vagina, and that constitutes the entrance to the uterus. And a lot of endometriosis, it's where it's most likely to be found right alongside the back of the cervix, called the uterosacral ligaments, which are two ligaments that keep the cervix attached to the pelvic sidewall. These women will experience great relief once the uterus and the cervix are removed. Now, obviously, there might be some super rare circumstances when a hysterectomy is needed to be performed at the time of childbirth due to a complication related to bleeding, when the hysterectomy procedure is done emergently and as a life-saving procedure to stop bleeding. The most common circumstance for that would be uterine atony, when the uterus is simply exhausted and cannot effectively contract to stop the flow of blood from the placental site, or the uterus is simply bleeding because of a placental problem, like placenta previa or placenta accreta. So when a woman hemorrhages from her uterus so profusely and intensely right after childbirth, she could literally die in minutes. Then obviously in these circumstances, sometimes a hysterectomy is necessary. So we can avoid that because we have now a device that's a special balloon that is actually deployed inside the uterus, and we can either fill it with water. Most recently, we can create a vacuum, and this device either puts pressure on the uterine walls and the uterine arteries at the bottom to decrease the blood flow, or it would suck the uterine walls closer together so it could stop the bleeding that way, and we can avoid a hysterectomy. This process is usually called uterine tamponade. So we're creating a tamponade, kind of like a tampon, but tamponade. We're, so to speak, managing the bleeding with these balloons. And rarely the uterus is so weak and unresponsive after vaginal birth that this procedure fails. But again, in these cases, a hysterectomy can be life-saving. So we talked about what is a hysterectomy and the most common reasons for which a woman might require a hysterectomy. But let me recap what are the pros of having a hysterectomy, which usually are very clear. But in case you were wondering, the number one benefit of having a hysterectomy is the cure of uterine disease and the resolution of symptoms caused by the uterus that's diseased. No more cancer, no more pain, no more bleeding, no more pressure and compression symptoms, no more painful sex, no more urinary issues if they were caused by a large fibroid pushing on the bladder, etc. Number 2 benefit for a hysterectomy, no more babies. It is the most effective method of birth control because without a uterus, you will no longer be able to carry a pregnancy to term. It is an actual sterilization procedure. So for any woman who still menstruates naturally or is using birth control at the time of the hysterectomy, this needs to be explained clearly, as they will no longer need a birth control method, condoms, or worry about babies after the hysterectomy procedure. Number 3 benefit is no more periods, no more vaginal bleeding ever after a hysterectomy. So many women love that, especially if they've been traumatized by heavy, painful, long periods most of their life. Any bleeding after your uterus comes out and you've healed from the hysterectomy is a sign of a problem and should not be ignored. It is not normal at all to have any type of bleeding after the uterus is removed. So the good news is you no longer need to buy and stock feminine pads or panty liners. Well, unless you leak urine, and that's a subject for another podcast. Number 4 benefit is no need to use progesterone to balance your estrogen after menopause. This is a blessing for some women who absolutely hate progesterone. It makes them tired and groggy in the morning after taking it at night, and it makes them very moody and bloated and causes water retention and sore breasts, especially if you need to take it daily and if you're sensitive to progesterone. However, you should consider, if you have none of these symptoms or problems, taking progesterone after a hysterectomy, minimum 10 days a month. Progesterone could help balance the growth and the proliferative effect of estrogen on your breast. It is a hormone that helps many other aspects of our mental health as women. This is a hormone that has great benefits for the woman's body, even after menopause and even without a uterus. And if you want to know more information about that, I have plenty of podcast episodes at the beginning of my podcast about progesterone. Number 5, no more risk of uterine cancer and possibly cervical cancer or ovarian cancer, as the tissues that could cause these types of cancers are gone if they are removed at the time of hysterectomy. Number 6, and this is a very important benefit because many women like this, there's no more need for pap smear, no more need for a transvaginal ultrasound, no more need for a biopsy in case of breakthrough bleeding after menopause on hormones. So many women dread coming to the doctor and they hate pap smears. Well, if you don't have a uterus with the cervix, there's no need for a pap smear. There's no need for an ultrasound. So I will end here, and in my next episode next week, I will discuss the downside, so to speak, the cons of a hysterectomy. I will discuss risks, some details about surgical techniques that you should know when this topic of conversation might come up with your doctor in the future. And again, this was all with the purpose of education and not to advise you whether you should have or not have this procedure. This is a very personal and very different procedure for many women. As always, I hope you found this topic useful, and I will meet with you next week on Hysterectomy, to do or not to do, part 2. Thank you so much for listening. If you are one of my faithful listeners and you are finding value and enjoying these episodes, please feel free to leave me a review on whatever platform you're listening to. Also, if you find the content in these topics useful, not just to you, but to someone else, a friend, a loved one, or simply an acquaintance that you know could benefit from the knowledge I share here, please feel free to forward my podcast to them. If you live in California and you'd like to work with our practice to help you achieve your wellness goals, please go to our website, www.herabeautyandwellness.com, and request an appointment. It will be our privilege to help you in any way, shape, and form we can. Any suggestions on a topic of beauty, wellness, or anti-aging are welcome. All you have to do is go to the website, leave a suggestion into the AI chat, and I promise you if you ask, I will listen and add your suggestion to my list of topics that I want to get to as soon as possible. Please join our Facebook group, The Wellness Optimizing Warrior MD. It's a small growing community that focuses on wellness, on what's new, what's safe, and what works in beauty, wellness, and anti-aging.